Alright, so in this lecture we'll be studying antitussives. So antitussives, first let us understand what is the meaning of this term antitussives. So antitussives are the drugs which are used to suppress or relieve coughing. Okay, so antitussives are a drug which are used to relieve or suppress coughing, and these there are two types of antitussives. Okay, so that we will discuss. But before that, we should know what is cough or khasi and the types of cough, all of these things. Okay, so cough in Hindi it is called khasi, and it is a sudden and often repeatedly occurring reflex, okay, which takes place due to the irritation of pharynx and larynx. So what is cough? So cough is any kind of repetitive or suddenly occurring reflex. Okay, so cough is any repetitive or suddenly occurring reflex. So it is a reflex mechanism. First we need to learn this, and which takes place due to any kind of irritation, whether chemical or physical or mechanical irritation of pharynx and larynx or tracheobronchial tree in general. Okay. Now there are various types of cough. There are two bases according to which the cough has been classified, on the basis of duration and on the basis of presence or absence of mucus. Okay. So if we talk about with respect to duration, so there are three types of cough: subacute, acute, and chronic. So subacute, which lasts for less than 3 weeks. Acute is lasts for less than 3 weeks. Subacute is lasts between 3 to 8 weeks, and chronic which lasts for more than 8 weeks. Okay. And on the basis of presence or absence of mucus, we have wet or productive cough and dry or unproductive cough. So wet or productive cough, we have no mucus formed, and the dry or unproductive, there is, I've just changed this. So in wet or productive cough, there will be mucus presence, there will be mucus formation, and it is seen in pneumonia, later stage of bronchitis. And in dry or unproductive cough, there is no mucus formed, and it is seen in allergy, initial stage of bronchitis. Alright, now we'll start with the classification of antitussives. Okay, so this chart summarizes this is the whole classification of analeptics. So okay, so antitussives can be classified into two categories: peripherally acting and centrally acting. Okay, so peripherally acting can be further subdivided into 5 categories, that is demulcents, mucosal anesthetic, bronchodilator, expectorants, and miscellaneous. Okay, and centrally acting can be further divided into 2 categories: opioid or narcotic and non-opioid or non-narcotic. Okay, first we'll discuss the examples. So peripherally or locally acting, we have demulcents, then we have mucosal anesthetic, then we have bronchodilator, we have expectorants, we have miscellaneous. So demulcents include honey, syrup, glycerin, licorice. Mucosal anesthetic include benzonatate, and bronchodilators we will discuss in the next chapter. Expectorants we have already discussed the examples, and miscellaneous includes dropropizine and levodropropizine. Okay. And centrally and locally acting, we have got opioid or narcotic and non-opioid and non-narcotic. So opioid and narcotic include codeine, dihydrocodeine, acetyl dihydrocodeine, hydromorphone, butorphanol. Okay, all of these drugs. And non-opioid and non-narcotic include dextromethorphan, noscapine, folcodeine, levopropoxyphene. Okay. Okay. So now we will discuss the mechanism of action for peripherally or locally acting and centrally acting antitussives. Okay. So peripherally or locally acting antitussives, these are the drugs which function only peripherally. First point, they will function only peripherally. What is the meaning of the fact that they function peripherally? This means that they act by suppressing the irritation at the sensory receptor in pharynx and larynx. Okay. So this means that peripherally or locally acting antitussives act by suppressing the irritation at the sensory receptor of pharynx and larynx. Okay. That is why they are called locally or peripherally acting, because they are locally acting at pharynx and larynx. Second is centrally acting antitussives. So these are called centrally acting because these are drugs which function by directly suppressing the cough center in the medulla. So these will directly suppress the cough center in the medulla. That's why these are called centrally acting. Okay. Now this point is also very important. Never prescribe antitussive and expectorants together. So what is the reason behind this? The reason behind is that what is the function of expectorant? Expectorant will increase the production of volume and fluidity of the secretions of the respiratory tract, and antitussives, they will suppress the cough center. So what they will do is, when cough center has been suppressed, so there will be no cough. There will be no coughing reflex. So when there will be no coughing reflex, so what will happen is that since there is no coughing reflex, so what will happen? The lot of mucus will be produced, but it will not be expelled out of the body, so it will get accumulated in the tracheobronchial tree. So that is the reason because of which you should never prescribe antitussive and expectorant together.